Hello, my name is Evan Fogt, and today I will be presenting the argument against Medicare for All. Did you know that according to the Pew Research Center, 68% of voters said that health care was one of their most important issues when casting a vote in the presidential election of 2020? In the day and age in which we live, health care and access to various medical treatments is intrinsic to our everyday lives. And with changes in our healthcare system, things would go very badly, very quickly. Although the world is slowly moving towards universal healthcare, privatized healthcare is still the best option in order to sustain our economy and allow for the best quality of care. I have researched this topic enough to know that private rather than public healthcare is best for Americans moving forward. Today, I will be touching on 4 topics. One being that how hard it would be to transition to public healthcare. 2 being the negative impacts that this would have on our people. The third being the issues with the current system in place, and the fourth and final argument being the response to the counter-arguments. According to columnist David Brooks from the New York Times, in an article about the struggle for Medicare for All, nearly 70% of people who have healthcare through their employer say they're satisfied by the care they receive. Removing people forcefully from what they are comfortable with and replacing it with an untested method is quite scary. Brooks goes on to highlight that the issues that would arise when healthcare systems in more rural communities are forced to cut the pay of employees because the sector of the economy would cease to exist, as the government would retain nearly full control of the market. Author Sally Pipes, in a book, False Promise, False Premise, The Disastrous Reality of Medicare for All, she states that in a place like Canada, where healthcare has become universalized, the wait time between seeing a general practitioner and a specialist is 20 weeks, while the average in the United States is just 3 weeks. For orthopedic surgery, patients can expect to wait a median time of 39 weeks, while in the United States, it is just 6 weeks. This is because healthcare has become less about the patient and more about the price that each patient costs, and thus reduces the quality of care in Canada. She goes on to say that every 1,000 residents in Canada, there are 3 doctors and fewer than 3 hospital beds. In a single-payer system, patients have to be matched with a family doctor. On average, in a single province with 175,000 people, most are waiting to be matched with a family doctor. Although Medicare for All sounds good, the negative impacts are much further reaching than you would think, and it is only after understanding that we can fully grasp those issues. In an article titled The Pros and Cons of Single-Payer Healthcare, author Linda Bloomberg remarks that with an obvious intended cut in the salary of healthcare workers, it would remove or at least lower the incentivization to provide quality care. She goes on to describe the issues that would arise when the government has to create an agency seemingly overnight to take over the healthcare responsibility of nearly 300 million people, while also still evaluating the price of medical treatments, which would hypothetically require systems that currently do not exist and would become nearly impossible to maintain. Finally, Linda Bloomberg touches on the idea of how real-world examples of government intervention have proven that with current systems, the government seems to undermanage the delivery of projects to its beneficiaries. This brings us to an assumption that with a Medicare for All system, the delivery of medical care to those who need it will be significantly underdeveloped and subpar at best. In America, some would say that we are lagging behind when it compares to other first world countries. However, on the same token, the problems that we currently face are that would only be worsened if a single-payer healthcare system were implemented. Currently, seniors over 65 and adults making under a certain amount are eligible to receive government-subsidized healthcare. According to author Richard Wolff, after passing of the Affordable Care Act and the expansion of Obamacare, Congress had the ability to create competitive pay for doctors, which would be comparable to that of what private insurance companies are willing to pay. However, they allowed payments to doctors to be cut by nearly 30%. This has made doctors start to restrict the number of patients that see who they are covered through government health care. In a journal, author Kaylee White states that if it was unclear before, it has only been highlighted by the current pandemic health crisis that things like vaccine development, and treatment drugs would likely not be possible, in large part, without the private healthcare sector and the work of large health corporations. Even the nation's top doctor, Dr. Anthony Fauci, says that the CDC screening process in the beginning was messy at best and full of missteps, and that we must embrace the private sector in order to find relief from the virus. Really, in the day and age in which we live, it is hard to form an opinion upon this topic, which it seems nearly impossible as every source pushes a single-payer healthcare system. Finding outlets who preach the opposite are few and far between. Many people think that pushing for Medicare for All presents interesting points that are at least worth talking about. In the article, How the U.S. Could Afford Medicare for All, author Gerald Friedman breaks down the possibility of expanding Medicare incrementally instead of all at once, then touted the savings that this would occur. The word savings is a misleading term because if savings mattered, the author would realize that more money would be saved if we stayed with a privatized system of healthcare. Friedman goes on to say that by reducing competition within the healthcare sector, that prices would decrease, but fails to mention how the attempt to add public aspects to private companies would create a whole lot of medical treatments along with supplies. Basically, while the author is correct in saying that reducing insurance companies are willing to reduce the cost to the taxpayer, he's completely leaving out the idea that this strategy completely stands alone from what the price of medical products is, because in general, prices are determined by manufacturers and not the consumer. All in all, with healthcare being one of the most talked about topics when it comes to casting a vote, it is easy to see how we are able to be divisive on every aspect. However, in order to progress as a society, we must defend privatized healthcare. Although single-payer healthcare is being touted as the next big thing, the system we currently have in place are the only way to keep our country and healthcare economy from collapsing upon itself. Thank you for listening to what I have to say.